Hi, I'm Dr. Rasya Dixit. We all know that Minoxidil is a wonderful medication for the treatment of male as well as female pattern hair loss. But did you know that Minoxidil can actually help in the improvement of the facial beard area as well? Yes. There are recent studies as late as 16 to 2024 where they have looked at various concentration of minoxidil, at least 3 to 5% applied on the beard area to 3 to 5 times a week on a regular manner. This can enhance the thinner hairs to slowly become more thick. But it all depends on the presence of vellus hair follicles in the beard area of a person. So what happens is, if the hair is present to a certain extent on the beard area but it is not becoming thicker, so you can definitely apply minoxidil up to 5 times a week, and over a period of 3 to 6 months you will see the development of the hair to become more darker, more thicker and more longer, and increasing the enhancement of the facial hair. Again, it can be used in the moustache area and the beard area of men. But remember that whenever we withdraw the minoxidil, this effect of minoxidil is not going to last for more than a month or so. So if you feel that you are a candidate for minoxidil induced beard growth, if you are feeling very conscious that your beard is not growing abundantly or thickly, especially following the constant trends and fads set by young actors as well as cricketers worldwide, they're all sporting stubble and beard. So people who want to do this treatment, do speak to your dermatologist. The dermatologist can examine the beard hair under a dermascope and actually tell you whether there are enough hair follicles or not to make sure that the hair will grow. It's a very interesting study which was done in 2024 which looked at identical twins. Two twins, boys, one was given minoxidil, one was not given minoxidil. And the boy who was given minoxidil actually started showing thickening of the beard hair after the period of 3 to 6 months, and there was a significant difference between him and his identical twin, bringing the scientific evidence that minoxidil is, yes, a good medicine for the treatment of beard hair as well. With minoxidil applied on the scalp, the side effects of minoxidil use on the beard is also irritation, local itching, as well as formation of redness or scaling on the beard area. This can be avoided by using alcohol-free preparations of minoxidil. In case of a true allergy to minoxidil, your dermatologist will be able to tell you to stop the minoxidil. In case of a true allergy to minoxidil, you will have to stop the minoxidil. Another side effect of minoxidil is that once you stop the treatment with minoxidil, the hair which has grown does reduce in thickness and size. So it has to be a long-term or a continuous process in order to maintain the results. To know more about minoxidil and minoxidil is a good option for you, speak to your dermatologist today.